Hi, welcome to Healthcare in Context. My name is Charlotte Safrit. I am a breast cancer survivor, a caregiver, and a patient advocate, and I'm the founder and creator of charlottepxp.com. And this is my partner.
Hey, I'm Caitlin Holcomb, founder of Wellness Communities. I'm a certified community health worker through Baylor Scott and White, and shortly after earning my MBA, I quit my job to start focusing full-time on helping people to dwell in wellness. And welcome to our series, Healthcare in Context. We call it this because contextual care matters. In fact, evidence shows that paying attention to contextual care factors improves the likelihood of positive medical outcomes by 70%.
We want to remind everyone that we are not doctors. Anything we say here is not to be construed as medical advice.
So still focusing on that diagnostic and screening portion, I want to pivot back to first your mom and that caregiving experience, and then we'll circle to you. But in both of those parallel stories, what do you wish you would have known?
So I guess with my mom, I think as a caregiver, I wish I would have known more about the self-compassion piece that we discussed, because remember, it's my mom has been gone now for about 6 years, and I didn't learn that self-compassion piece until more recently. I think really my own cancer experience, in a lot of ways, it helped me understand not only ways that I did fail her, but also ways that I couldn't have helped it. And I did do the best that I could at the time. And also one of the reasons that I wanted to get this information out there. So I guess I would say the biggest piece for me that I would have wanted to understand as a caregiver is that it's okay not to be able to meet all of their needs. You can't. You're a human being. You're not going to. And that's okay, because all they really need from you is love. That's all they really need. And as long as you can provide that for them, then you're doing good, you know? And you should be able to give yourself a rest and a pat on the back when you need it, because you can't take care of them if you can't take care of yourself. And as far as the diagnostic piece, I will say, I do think I wish I would have known more about the resources in the area. I remember one person told me I should contact the American Cancer Society. And at the time, I was working like a full-time job. I was working night shift. I didn't have time. I mean, I felt like I didn't have time to talk to anyone else, and it felt like just another task. But sometimes you have to do that one extra task so that all of your other tasks are easier. And I think that that's a really hard piece to to convince someone of if they have not been in this space for a long time. And especially when they're trying to make it through the day, you know, and they're trying to figure out how they just worked like a 12-hour shift and now they've got to stay up all night and sit beside their mom, you know. They have uh, places that you can go that will help you decipher your lab report. And I didn't know about that. You know, I didn't know about it at the time. I found out about it 2 years later when I wasn't emotionally completely, paralyzed like I was in the beginning. And I wished I would have known that in the beginning.
Yeah.
Yeah.
Because particularly if you don't have a medical educational training, interpreting lab results based off the information that you can find on the internet can be a little tricky and misleading sometimes at best.
Yeah. And God forbid you get in there and you start talking to someone who's just there to get your information.
Exactly.
You know, there's just so many pitfalls, and it's a time in your life when you are so vulnerable and you are in a state of panic and you need help. But it's also a time that bad actors can use to take advantage of you, which is something I always worry about with people coming into this.
So, community of resources, you named Living Beyond, you named Cancer Support, you made American Cancer Society. I know Susan G. Komen is another resource. Specifically, the community piece in terms of talking through people who had experienced the same thing you'd experienced as patients, as well as that's a really interesting point about also talking with people who are trained to help you interpret lab reports and such in a timely
That's
manner
true.
when you're not getting called back.
And there's also cancer coalitions in most states, not all of them. And if there isn't one, you should probably start it. But I digress. But I mean, all those are really, really important, and I will list them at the end of this episode because I want people to know that there is help in all of these places. I mean, they're mostly devoted people who spend their whole lives trying to connect patients with better resources.
And what is it that the cancer coalitions do?
The cancer coalitions do a lot of different things, but one of their biggest things is their lobbying. For instance, in PA, our PA Breast Cancer Coalition worked with our senator and was able to pass something called Article 1. Article 1 enables everyone in PA who has an elevated risk or dense breast tissue or a genetic risk to get imaging regardless of insurance. It's huge. And it also is one of the things that enables people to tell you if your breast tissue is dense and to tell you what that means. So oftentimes if your breast tissue is dense, you have to, or you should be offered other forms of imaging such as ultrasounds and sometimes MRIs based on your own specific circumstances. Reasons it's so important to have standards in place. And that article is such an important piece, and it's going to save so many lives because now there's a standard in place for women with breast, women or people with breast, chest, and density with yes, with dense tissue, um, and I'll cut that
You're
part out.
good.
That's fine.
You're good. That's it. I read side note, I read something. I'm going through Super Communicators right now, and I'm thinking about the book, and I'm thinking about that in terms of how we design the AI and how it interacts with people. Um, and one of the things that I was talking about recently was when they were looking to try to assess the psychological readiness of NASA astronauts to handle the stresses of space. Their emotional intelligence was a huge thing that they looked for, but they were yielding the same results across the board because everyone answered the questions the same way. But what they started to first notice as a trigger for whether or not someone was psychologically ready was laughter. And it's because the laughter was the most genuine cue of you're not always laughing at something funny, but it's a laugh as a desire to connect or a show of connection. So, I mean, that came to mind because we're here talking about something incredibly heavy, but still smiling.
Well, I think I think sometimes, especially when it comes to talking about breast cancer and all of these crazy things that I've been through, it's not just a survival mechanism, but I do think that's a part of it for sure. But I think it's also it's just so ridiculous. It's so ridiculous all the stuff that you have to go through just to get someone to care about you and give you what you need medically. And and I understand just the ridiculous ideal of all of it because all the medical professionals, all of the lab people, all of them got into it. They didn't get into it necessarily for money. There has to be some component to want to work that hard because you help and you want to help and you care about people. And we're so disconnected from each other that I think it's a bit of ridiculousness. And it is comical to me, you know. So
It's so noting, I don't think you should cut that part out because that was a pretty brilliant candid moment.
yeah.
But yeah, it's part of what's feeding burnout among
Yeah,
clinicians and physicians and nurses. But it's
absolutely.
also when you actually are able to cut through the noise, as we've been seeing with these interviews, that's when you get to some of the most rewarding parts of what does work right in healthcare. And it is that human connection piece.
Yeah. I still think about I wish that I remember going in there with my like little questions that I found on the internet and I changed them on my Google Doc and I went in there and I sat down and talked to my team, which is another part of the diagnosis process. So one of the places that I went was like, okay, so here's how it works. Do you want to talk to your surgeon first, or do you want to talk to a team? And the team is going to be filled with your surgeon, an oncologist, a radiologist, and they will all work together, look at your case, and then tell you what their recommendations are for you at this point in your treatment. And I was like, okay, so that sounds really good. I want that. But how far is that in scheduling? And they were like, well, we could get you in this week with your surgeon, or you can wait 2 weeks for the next big meeting. And I was like, well, I mean, how fast is my cancer growing? Which is just it's ridiculous. But that's what I was like, is it like growing really fast? And they were like, well, it usually doesn't grow that fast, the kind you have. And I still think like, I can't even imagine lawyers would have had a field day with that answer. It's so hard for them to figure out what to say to you too. I remember sitting there with my questions and I didn't ask. I think I asked a few of them and I may have written an answer down or something. And then I probably threw that piece of paper away, and I had a support person. My husband went with me, but I think he too was like emotionally, compromised.
Why did you end up throwing that piece of paper away?
It's like a tidal wave of information that just gets dumped on you. And then you have to figure out what to focus on. And I think that's really why the community health workers and the nurse navigators are so important. And that really should be sort of like where they focus, right? Which is helping you sift through the information, tell you what you should be focusing on in that moment.
Makes a lot of sense. So we talked about some of those resources that are helpful. I know that you and I have talked separately about other financial resources that can be helpful. There's also the resource that we've created with the curated list of products that are helpful at various points in just symptoms.
That is such a big one. I still remember getting those really well-intentioned gifts and thinking it was so sweet. And in fact, it became a point of stress because I would not throw them away. And I had a bin of cancer stuff that I had for 2 years. And I want to say maybe once a month, my husband would say, like, when are we getting rid of this stuff? And I would say, I'm going to give it to someone because somebody needs this. And I'm not going to throw it away because it felt wrong to throw it away, because this was people's outreach and their love that they sent to me. But there were a bunch of them were products mostly that I couldn't use. Scented candles. I mean, I couldn't stand the smell of a lot of things when I was in chemo. Just lots of random lip products and candies for nausea.
So why did those lip products and the candies for nausea and such, why were those not usable for you?
Most people have either their favorites or you want, especially when it comes to a lip product, most of us have favorites, or we at least want like a high quality item, that maybe we've never tried before. We don't want like, here's a standard chapstick that doesn't even have SPF in it. It's just some wax. Rub it on your mouth. You know, but it's got like a thing that says like feel better on it, which is, I mean, nice, but what you really want is a product that works, right? So
And the SPF component is extra critical.
it really, yeah. You need the SPF because a lot of the medications make your skin more sensitive to light, and that's a big concern. You also, your skin cells don't heal as quickly when you're on chemo.
There, you were at, there is so many nuances.
I think it's so interesting to me because as a company, if I were making uh, a cancer basket and I wanted to make money off of it, I would ask the people at my job to tell me if they'd ever had cancer, and if so, what their favorite products were, and see if you could put them in there. I wouldn't just randomly be like, let's see how cheap we can make some chapstick and then we'll put like a sticker on it. You know, because to me, if you're going to sell something more quality, you're probably going to sell more of it. But sadly, there are not enough people who consult in the cancer space or who are paid appropriately to give companies that information, I suppose.
So, with that noted, looking back at your mom and her journey, and then paralleling that with you and your journey, what in each of those made your life easier, both as a caregiver, made her life easier as a patient, and then made your life easier as a patient?
Wow. I mean, community, the power of community cannot be overstated. My mom had friends that when I couldn't take care of her, they would step in and take care of her. One of my mom's best friends used to be a nurse. And when my mom was still living in North Carolina, I would take my 2-year old and drive down there and stay with her for a week. And then I would come back to Pennsylvania and get a week off and then go back the next week. And when I had that week off, my mom's friend would stay with her 24 hours a day and take care of her. And I don't know how I could have survived without that. I needed it. And for myself, I mean, I couldn't have done it without the childcare that my husband helped me with. And I know that I'm privileged in that way, that I even had anybody who could help us. I mean, there were so many times that I missed my mom and I wish that she was there for me. But I knew that I was still lucky to have my husband. And it's one of the reasons I wanted to get into advocacy, because I understood that not everyone has that. Not everyone has a support person. And certainly sometimes you want a support person that isn't as emotionally as affected, right? Because as I stated, whenever I got diagnosed with my husband, I think he was also in a state of emotional, turmoil, and I don't think any of us necessarily operate the best way that we could. I think if there were if it were a perfect world, I would certainly want more community health workers to be in that space to help take over that burden. But during my own experience, I will say certainly digital resources. They were beyond the community piece. I don't know what I would have done if I couldn't have looked up those terms in my lab reports, if I didn't know where to go.
Digital resources.
That's right. Digital resources are key. And it's one of the reasons that I think that we're in this interesting place in history, right? Where things are moving so quickly. It's so exciting. There's so many new treatments. So many people can be saved if we're able to utilize digital resources in the best possible way in the healthcare space, because we can build a newer, faster, better way to connect doctors with patients again and to connect patients with the care that they need.
Which digital resources did you find most helpful?
So for me, it was just The obviously anything that connected me with other patients. Uh, Once again, I sort of had to use my own discernment because not everyone who answered was giving me great answers. Some people would just say, "Oh, well, you don't need to take medicine. You don't need chemo. You don't need any of these other drugs. You just need to cut sugar out of your diet." And I personally know that sugar is not the answer, because if it was, then my husband would be the one who was sick, not me. Man eats like a cookie a day. So, um, so the community, online community resources, online nonprofit services, online scientific research. I remember there were times when I didn't know whether I had to go to the ER or not, right? And I was like, I had these children to figure out what I'm going to do with them, and I only have like one person who can drive me, and I don't know if it's worth going in. I think those are times when it's so important to have access to good quality digital resources.
Thank you so much for opening up about the diagnostic and screening portion and just kind of that first part of your journey. We hope that this was helpful to our listeners, and stay tuned.
I'm glad to be a part of it. I had this crazy experience, and I'm finding out more and more that it wasn't necessarily crazy. It's sort of standard. But I think that it taught me a lot. And throughout the whole process, I always thought, I wish I knew this stuff going in, because it would have made the whole process so much easier. So just hope that it can help make your life a little bit easier.
We'd like to give a big thank you to our guests, and we hope that you'll join us for the next episode. Context is everything, and healthcare and life. If you believe in what we're doing and want to support us, please remember to like, subscribe, and share our channel. Reach out if you want to be on our show, or you think we should cover another topic. What did you learn from the show today? We want to hear from you. Contact us at hcincontext@gmail.com. Leave a comment or look us up at wellnesscommunities.com. One of the most common questions I get asked as a cancer survivor is, what should I send to my loved one who was recently diagnosed? So that's why I helped create a curated list of products at wellnesscommunities.com in the Shop tab. It contains products that are tested and recommended by the people on our show, including me. We'll take a portion of proceeds and donate it to Undo Medical Debt. For every dollar donated, it will pay off $100 of debt. It also helps us continue to share these stories with you. We wish you wellness. And if you aren't feeling well, remember, there are people out there working hard to make you feel better. See you soon. Until then, take care of yourself and stay cozy.